Hi everyone, thank you for meeting with me today. I know working in healthcare, we all have very busy schedules, so I appreciate your time and effort to better our hospital and hopefully educate ourselves on telecommunications and the benefits that entail and taking time to learn them. As some of you know, I am a fellow ultrasound tech at the hospital. I am currently located in the emergency department. So I work a lot in patient care, and I know that communicating with our patients can be challenging, and there's a lot of unnecessary visits that we have, especially in the ER, that could easily be fixed via technology so that it's easier on our patients and it's easier on us as the healthcare providers. I personally travel for a living, so I have seen the effects of telehealth and the benefits of the entire hospital being on the same page on what it means and how we would implement it in our system. I have worked in places that have no telehealth. I have worked in places that do have telehealth, and I can guarantee you that it really is helpful and beneficial, and especially in the last few years with the COVID-19 pandemic, we have seen a huge impact from telehealth. So let's dive into what telehealth is. Telehealth is a subcategory of telecommunications. Telehealth is a means to communicating with our patients from outside of the hospital. So patients can call from their home, they can call from their car, they can call from wherever they are as long as they have Wi-Fi and depending on the system they're using. So this could be a computer, a phone, it can be through email, it could be a FaceTime call, it could be an audio call based off of what the doctor and the patient think is appropriate for their situation and the care that they're seeking. And depending on our conversations today, we can kind of discuss what that would look like in our hospital, and I'm sure it'll look different in every department. As an outpatient facility, I'm sure we would be able to do FaceTime calls, but in the more busier settings, I'm sure that an audio call could be warranted depending on what the patient needs. So by the end of this presentation, I want to make sure that we all feel open to discussing, because there are pros and cons, and I know that this is a group decision. So if there's any questions that need to be answered, we can review it all at the end, and you're always welcome to email me after the presentation as well. So how does this benefit us as healthcare professionals? Well, healthcare professionals, as we know through the COVID-19 pandemic, we are also susceptible to different diseases and exposures. And in order to protect our staff, I think it's super important that we allow patients that are sick and don't necessarily need to come in, but they can get medications or prescriptions or continued care outside of the facility. We should take advantage of that. We also will have higher productivity because these online and audio physician calls can take 5 minutes, 2 minutes, 15 minutes, or an hour, but they're a lot more efficient because our patients aren't waiting out in the patient waiting rooms, and they're usually a lot happier about that as well. So our communications with our patients tend to be a lot more positive, which is awesome. And it also saves them time as well, not only us, but them, so that they are not waiting in the ER for hours on end. We can do a quick phone call, figure out their symptoms, and decide if and when they should come in, which is very, very, very important because, especially in the emergency room where I'm working right now, we don't want our ERs completely packed and people taking rooms that are essential for true stat emergencies. So as healthcare professionals, and if we do implement telehealth, it's very important that we assess the patients and decide if telehealth really is what's right for the patient. What we don't want to have happen is to tell someone, hey, we can do this over the phone, and find out that it was a true emergency. So we need a vetting system to where they call and we decide if it's important for them to come in or not, such as mental health issues. We could always set up a counseling session. We can always, change prescriptions, talk to the patient, and assess their risk. And if we feel like it is a true emergency, we can always send them into the hospital. We do not want to be using telehealth as an excuse to not have a patient come in. We want to make sure that it's more of a means to a conclusion or continued health for the patient. We want to make sure that we're having high quality patient care. Benefits for the patients I would like to dive into. So patients will no longer have to travel if they're from out of town for small routine treatments. So me as a traveler, I think this is huge, because when I'm traveling and moving every 3 months, it's super essential for me to get my routine care, but I'm not going to be able to fly back home for every hospital visit, outpatient facility, every cold, cough, anything that I have. Being able to call a physician for urgent care needs is huge for me, and it saves time, money, and personally, I'm just more satisfied with the experience. Outside of people that are living out of town, there are also people who are immune compromised. So coming to a hospital where they could be subject to a lot of different viruses and pathogens, we want to keep them home and keep them safe. So the telehealth also has a place in that role as well. We also cannot forget about people who are disabled. We have many people that have to go through different facilities, getting a bus to come to the hospital, trying to get any type of way to get to the hospital. And transportation can be very, very challenging, especially if the patient has machines hooked up to them, or depending on their disability, it looks different with each patient. But it's very, very, very important that if it's not essential for them to come in, we want to lower that risk of a fall or an injury in transportation to the hospital. We also have patients that are going through rehabilitation, so they might not have a chronic disability, but in their current state they might need to eliminate visits. Now this could mean not even eliminating all of them. Maybe we just, instead of doing all visits in office, we say, hey, we want to see you in office once a month, but once a week we'll check in with you through telehealth. Now, in theory, this all is amazing, but telecommunications can be challenging. There are cons. There are many patients that do not have access to Wi-Fi or higher technologies, and also a lot of the elderly community has a hard time working on telecommunications and different systems. So this could look very hard for a lot of us, trying to communicate over the phone if the patient doesn't understand how to look things up. So there would be a lot of educating. There would be a big education curve, and that could even be in the hospital too. We have a lot of physicians and practitioners that might not have used some of these newer telehealth communications. So we would have to implement training. So that takes time out of our schedules, and it would have to be done in order to guarantee that it was really worth our time to invest in telehealth technologies. So that is definitely up for discussion too, because I know that it's very hard to take time out of our schedules for that. And a lot of electronics can be very, very, very stubborn, for lack of a better word. So if Wi-Fi goes down, there goes some of our appointments, and it can be very, very frustrating. So we do not want to use telehealth as a replacement for care. We want to use it as a means to seeing our patients eventually, to eliminate problems that can occur from not seeing them in person. The really awesome benefit of telehealth is some of the newer technologies. You can send pictures. So if a patient has a wound or has a burn or something that we would need to see a picture of via computer or phone, they are able to text it or send it over email or upload it onto the file. So that's very, very, very nice. And a lot of the new technologies have ways of uploading your vitals, making sure that the physician knows who they're working with, your prior surgeries, prior medications you're taking, so things that could affect the care that they would be helping you with moving forward. So with that being said, I would love to open the floor to anyone who has questions. And I know that, where I stand before we get going with that is I really feel that this is really essential, and I know it will take time to educate our patients and our staff to do telehealth, but I do think it is a huge, huge responsibility as healthcare professionals to better ourselves and always look to being proactive and keeping up with the newer technologies. Through COVID-19, telehealth really provided a huge, huge, huge basis for us to communicate with our patients. Even though we had to keep a distance, we didn't want to put autoimmune compromised patients at risk. So moving forward, we can use these experiences to our benefits, learn from the past, and move forward and hopefully make a better hospital. So if you could contact me after this presentation and let me know if you have any thoughts and opinions, and we can go from there. Thank you.